Unfortunately, we're never going to get the government out of nursing. Here's why. In 1908, hospitals were unregulated. Back then, people were paying for services privately to the physicians. In 1904, the AMA began regulating doctors. By the 1920s, medical costs began to rise. By 1929, the average family was spending $103 on medical expenses. That was 5% of their annual income, which was around $1,900. By 1929, Baylor University contracted with teachers, allowing them to take 21 days of hospital care per year. They had to pay a monthly fee of 50 cents per month for that. Similar prepaid medical services began to roll out. By 1937, there were 26 plans such as this. Blue Cross networked and rolled out their plans through the American Hospital Association, the AHA. Then it started going into the state legislature. The state legislature started to follow them. Hospitals were allowed to then become nonprofits, allowing them tax exemptions. Now, we all know what that does. That pays for your C-suite level people, okay? Your CEOs and all your people, your CFO, your COO, all the C's, C-suites, the suits. By the 50s, hospitals started to realize that their costs were starting to double. Medications were available, vaccines were developed, yada, yada, yada. By the 60s, there were 700 companies selling insurance. 700 companies. By the 1960s. What they found was the elderly and the poor were having a difficult time paying for this. By 1965, Congress created the Medicare and Medicaid infrastructure. In 1966, Truman pushed it all through. A lot of people think Roosevelt created that. He created the committee that was the Social Security Act. He did not include healthcare in that because there was a lot of controversy back then around it. But it was actually Truman that signed it into law and everything. Overnight, the federal government became the single largest purchaser of the healthcare services. What then began to happen was the hospitals, the healthcare systems, the doctors, device manufacturing companies, drug manufacturers, everybody started to get financially backed by these entities. And then what we saw over the last few decades is we saw hospital market consolidation. These big conglomerates started to get in on the game, and everybody started monopolizing the healthcare system and monopolizing hospitals and such. Thanks to CMS and everything else that goes on, there's no way that they will ever jump out of bed with the nursing profession because we make up the largest bulk of the healthcare profession. And when you understand who's controlling the strings and how that is all determined, you understand that that's not up to us.